Good afternoon. I want to thank all of you for joining this town hall for our faculty. We received over 100, I should introduce myself first. I'm Chris Bono. I am a professor of political science and also president of the University Senate. We received over 130 questions prior to this town hall from over 100 individuals, and we have over 800 individuals who have registered for this event. If you are joining us on Zoom, you can type questions using the Q&A button under at the bottom of the screen. Chat has been disabled, but you can use Q&A. I have consolidated the questions and edited for brevity so that we can get to as many as possible. And I will also ask follow-ups where appropriate. I have prioritized the questions we've received based on one, the immediacy of them, and two, things that have not yet been addressed or will not soon be addressed on coronavirus.pitt.edu. Following this event, a recording of the town hall and summaries of many of the questions will be made available on the Office of the Provost website. And now I would like to introduce the panelists. We have Ann Cudd, who is the Provost and Senior Vice Chancellor, Cynthia Golden, the Associate Vice President, Provost and Director for the University Center for Teaching and Learning, Mark Henderson, who is the Vice Chancellor and Chief Information Officer, Javette Washington, Senior Vice Chancellor and Chief Legal Officer and the Executive Sponsor of the Resilience Steering Committee, and John Williams, who is Director of the COVID-19 Medical Response Office. As you can see, we have people here leading all aspects of the return to campus, from technology to education to health and safety. Before we go into the questions, some of the panelists will briefly provide some initial information. This information is in response to some of the most frequently asked questions we received, and so we thought it was good to get these out of the way at the outset rather than wait till later on in the webinar. And with that, I will turn it over to Provost Cudd.
Thank you, Chris. Good afternoon, and thank you for attending today's town hall for faculty. I'll begin my remarks by reminding you of the overall framework. Could we go to the next slide, please, Max? Thank you. The resilience framework that frames Pitt's approach to teaching and learning for the pandemic period. The framework is designed to maximize our accomplishment of our mission as a research university while protecting the health and safety of the community under the conditions of the COVID-19 pandemic. This framework is being developed by health and safety experts and teaching and learning experts from our own university community, including faculty, staff, and students who served on the task force to reimagine a Pitt education, the healthcare advisory group, and a chief medical officer who's here with us today. Their expert advice is being used to create and publish the standards and guidelines by the Resilience Steering Committee headed by Javette Washington. The standards and guidelines are all collected together on the University Policies website at the URL on this slide. New ones are being added every day, and I urge you to check back often over the course of the next couple of weeks. Next slide, please. The standards and guidelines determine what can and must be done in the three operational postures that depend on the conditions of the pandemic: high risk, elevated risk, or guarded. Flex at Pitt is our flexible teaching modality that is designed to allow us to continue teaching and learning in any of these postures. In guarded posture, Flex at Pitt allows maximal choices for faculty and for students, as they may choose to be in person in the classroom or not for almost all classes. In elevated risk, faculty and students will, with few exceptions, be forced to remain remote and may only choose to be in the classroom or lab if there are fewer than 25 students in the class. There is a special reason that justifies being in the classroom together, such as a hands-on lab, and the faculty member has received permission from their dean to do this. In high-risk posture, all classes would be remote without exceptions. Next slide, please. Let me elaborate a bit on Flex at Pitt. This is our version of the high flex modality of teaching, with the added flexibility for the instructor to remain remote, but use technology to be present virtually in the classroom to lecture, conduct discussions, answer questions, and guide students in small group exercises. I want to be clear about this. We are not requiring anyone to be physically present in the classroom. However, the Flex at Pitt provides the possibility for students or faculty to be in the classroom when pandemic conditions allow. Since we will have students who are choosing to study away from Pittsburgh, Flex at Pitt allows them to participate asynchronously, which will usually be accomplished by viewing recordings of the classroom experience. The Center for Teaching and Learning has created a playbook for Flex at Pitt and provides a wealth of advice and one-on-one consultation for creating or modifying courses to fit and optimize the Flex at Pitt model. Cynthia Golden will say more about this. In addition, Mark Henderson is here to speak more about the technology being installed in the classrooms and the technical assistance Pitt IT will offer to faculty as they teach in Flex at Pitt. Next slide, please. Why are we employing this Flex at Pitt model rather than, say, going completely online for the entire academic year? Flex at Pitt means that courses have the flexibility to change modes of instruction when the university changes between postures, while maximizing classroom experiences when in guarded posture. It gives the students the flexibility to choose in-person, remote, or combinations of engagement with the classroom experience, and the flexibility to change their choice at any time for any reason. And Flex at Pitt gives faculty the flexibility to choose in-person, remote, or combinations of engagement with the classroom experience, and the flexibility to change their choice at any time. Flex at Pitt leverages technology to enhance interpersonal interaction and allow multiple modes of instruction in all combinations of operations. This flexibility exemplifies personalized education at Pitt, where we enable our students to forge their own path. When our faculty and students suddenly had to pivot from the normal in-class teaching and learning mode to fully remote teaching and learning last spring, we learned a lot here at Pitt and from surveys of faculty and students around the nation. What these surveys of students have consistently told us is that students want to be on campus rather than at home. They tell us that students value the opportunity to learn together in classrooms. In particular, they have told us that they want the sense of increased accountability, that having a specific time and place where they have to be ready to learn. They have told us that this also assists them in planning their days. Classroom plans provide structure for time management. And they told us that they really like seeing each other in the classroom. Finally, if we were to give up now and go all online without planning for the in-class modality, we would not be able to change our operations to go back to the classroom when conditions allow. Flex at Pitt provides the structure for planning for whatever conditions we will face in this pandemic. Thank you again for coming to this town hall and for your work to create an unprecedented year of academic engagement.
Thank you, Anne. Now we'll hear from Cynthia Golden, Associate Vice Provost and Director for the Center for Teaching and Learning.
Thanks, Chris, and hi, everybody. It's nice to be here. I know that many of our faculty are or have been working with some of our consultants in the teaching center. And I just want to say that we too recognize that this new model is a challenge, and it's something new to learn and to figure out. And while we know that there might be some bumps in the road or that you might have a lot of questions, we also have a lot of people who are working very hard to help you and to help our students. And so today I want to say a few words about where to find that help. The graphic that's on the screen now is something that we put together to illustrate how to think about your teaching as we move forward. So in the beginning, thinking about what can you adapt of your content to an asynchronous mode. We know we're going to start online, but that we really need to be ready to flex to face-to-face teaching, as the provost said, while supporting some students who are participating remotely. So really looking at everything and looking at your course and figuring out what you can adapt as a first step. Then thinking about how it's going to be delivered. What will work what will work best in a face-to-face mode? Things like arts activities or clinical work, or times when you need to give individual feedback. And then finally, in any of the postures, you can offer asynchronous online sessions things like office hours, group discussions, question and answers. So thinking about your course overall and how you will adapt it is the first place to start. And we have a wealth of information on our website to support you as you work through this. Can I have the next slide, please? If you visit teachingatpitt.edu, it's being updated every day, and there is a lot of material there that you'll find helpful. I want to call your attention to the playbook that the provost mentioned. There are resources here to help you with the implementation steps, to think about course delivery and design options, to think about assessment strategies, and there's a really nice frequently asked questions list that I think would be helpful. Can I have the next slide, please? This is a graphic that's part of the playbook, and it outlines the options that are available to you depending upon our operational posture and the particulars of your course. And I don't want to go over all of this right now, but I just wanted to show you that there are things here that will help guide you and help you to figure out the balance of synchronous and asynchronous class activities. Faculty have told us that this and other playbook examples have been very helpful. So I would encourage you to spend some time there and take a look at that. May I have the next slide, please? And I also wanted to say that in addition to the playbook, there are a lot of things that are happening in the Teaching Center and that are accessible through the website. So we have a number of workshops scheduled on topics like instructional strategies, how to use Canvas, how to use Zoom and other classroom technologies. There are a lot of videos that you can watch of the workshops if you can't participate in them, and also how-to videos and video information, how to get things done. We have a newsletter that comes out every Friday. I think almost every Pitt faculty member is subscribed to it, or many are. You can subscribe on our website, but we will announce a lot of new things as they get added to the resources through that newsletter and directly through our webpage. And there are faculty learning communities that we have going on looking at, things like teaching large enrollment courses together in our postures. So I did want to mention that we are doing some limited consultations, and you can sign up for those on the web as well. We have had people cancel some consultations actually because they were able to go to the website and find out what they needed. So again, I'm just trying to emphasize the wealth of resources we have available. And finally, next week, there will be a faculty panel on successful strategies for teaching, experiences that people had over the spring and summer. So watch for the time and date of that. It's being worked out right now. So if you don't find what you need on the website, I urge you to visit it. If you don't find what you need, please send an email to teaching@pitt.edu, and somebody will get back to you soon. So thanks, Chris.
Great, thank you very much, Cynthia. Now we have Mark Henderson, the Chief Information Officer and Head of Pitt IT.
Good afternoon, all. I'm going to just try to share as much information as I have at present. As many of you may know, we're working with a vendor partner named Radiant on the installation of technologies in classrooms and other teaching spaces. Installation began on Monday, and it began in Posvar Hall. We will have visibility into when we can demo classrooms next week. We will not have people in each classroom. That's not, we can't achieve that because there are 200 plus classrooms and I think 12 or 1,500 classes. But the type of technology that we're installing in the registrar managed classrooms will be remotely monitored and can be remotely controlled for start of classes or troubleshooting. These technologies will be fully integrated, which will allow for this. Microphones for faculty members where needed in classes to project voices will be made available. We are working on options to provide a similar level of service for non-registered classes, which may have other non-integrated technology, and we have visibility into how to achieve that. We will have the ability to dispatch technicians where required to remediate problems which cannot be handled online. But again, we'll be monitoring the technologies in the classrooms constantly. We will continue to evolve capabilities in these classrooms as we learn from faculty and students. We're somewhat constrained by our supply chains and the timing. We have 45 days to achieve installation of technologies in over 200 classrooms and teaching spaces. So we're going to be adapting and improving as we go, so we welcome your feedback. We will work with departments on specialized needs. So for example, a question around studio classes. An example I can give you is we experimented with Surface technology, Microsoft Surface devices, where with the camera, a student was able to angle the camera to her fingers on the keyboard of a piano and was able to successfully complete her assignments that way with her faculty member. We also have worked with departments on building out of virtual environments to meet specialized needs. This is kind of like building the plane while we're flying it in some respects. So again, I want to emphasize, we welcome your continued feedback on improvements. We strive to meet your needs. So thank you, Chris.
Thank you, Mark. And finally, before we turn to our questions, we'll hear briefly from John Williams, who is the head of the COVID-19 Medical Response Office, who will talk a little bit about testing and our plans in that regard.
First Zoom call failed. Thanks, Chris. Thanks, everybody, for attending. Max, can you bring up my first slide, please? I'm just going to show you a couple of slides about our testing strategy. So just the first few. One issue for testing, and I'll tell you in a second how we'll do testing, is that the availability, which I am sorry to say 6 months into the pandemic nationally, is very limited, and that's not getting better, at least anytime soon. Another problem is that there are false positives, lots of false positives when you have a low prevalence rate. And we know in asymptomatic young people, the prevalence rate is low. There's a huge effect of the test results on behavior. False negatives lead to a false sense of security, and that's related to the natural curve of viral kinetics, which I'll show you on the next slide. So why do any testing? Because I'm sure you're aware, other universities, some are doing no pre-arrival testing and they're only testing symptomatic students. We do plan to test symptomatic students. Some are saying, well, we're going to test everybody before they arrive and then we're done. And neither of those is really the right answer, and I'll show you why. The reason we're doing the testing we are is that most of our students are coming from outside the immediate region, from other parts of the state, from other states in the US or international. And we have a pretty good handle on local prevalence. Allegheny County does a great job there, but we don't really know who's coming. So we need to have a sense of the population prevalence. Next slide, please, Max. Okay, so for doing these tests, looking for the virus in the person's nose, the timing is everything. And I know this is a busy slide. If you just look at that blue bell-shaped curve, which is very familiar to you as university faculty, that's actually what viral replication looks like in a person's nose. So if I were infected right now, I would test negative for anywhere from 4 to 7 days, even though I have virus. And I can start spreading that virus. And as you see, often that peak of virus is not related to peak of symptoms. And remember, we know that young people can have completely asymptomatic infection. So a single point in time test, within the 5 days before somebody comes to campus and then no testing afterwards is really not helpful. And for those reasons, it's specifically not recommended by the CDC or the American Collegiate Health Association. So what are we doing? Next slide, please, Max. You can go ahead and click through these. One option would be the mass testing of everybody, which we're not doing. I explained why. One would be to only test symptomatic and respond to cases. And we will test symptomatic students, but because of asymptomatic spread, if we only look at symptomatics, we could have a lot of spread before we know what's going on. So we're using a time-honored method for determining the prevalence of disease in a population, which is systematic random sampling. And I'm not going to get into the weeds of this, but we have statisticians and epidemiologists. We're lucky to be at a great university in the Graduate School of Public Health who have helped us find a systematic way to test a representative subset of students from those groups regional area, rest of Pennsylvania, rest of the US, international, on and off campus. And that will tell us in those first couple of weeks of arrival, what is the prevalence of all the humans that we just brought. And that will guide what we do going forward. Yes, it will find a few infected individuals, but much more important is to know, what the rate is in the students coming in. And I think that's all I need to say about the tracing. So then we could go, about the testing. This is what I just sort of said. These are the groups, and there's a lot of literature on the methods that we're using. So I think, Chris, I could stop there and go to the questions when people are ready.
Okay, great. Thanks so much, John. All right, so let's start with some questions. We've got some stuff coming in the Q&A, and we also, again, had stuff that was done in advance. So the first thing, and I know the Provost Cud, you said this, and it's been said repeatedly, but there's still some questions about this. So just to confirm and get clear, so there's no misunderstanding, because I think some faculty are getting different signals from deans. Faculty do not have to do anything in terms of forms, notifications, etc., if they plan to teach their classes entirely remotely. That's correct?
Well, we are asking faculty to submit their plan for performing the Flex-It PIT model to their dean. So in effect, that will tell their dean what they're doing.
Right, but we don't need to disclose any kind of medical information or
No,
personal situation.
no,
It's totally the faculty's option if they want to teach in the
Absolutely.
classroom or remotely.
absolutely.
Okay,
Right.
good. So I know this is going to be released soon, but we have a lot of questions about this too. And so I think it's helpful to get it clear now. Will students, faculty, and staff be required to wear face coverings on campus? And what if they cannot or will not?
Yes, but I think maybe that's a question better answered by Jovette.
I didn't know I was getting this one, but that's fine. So the guidance on wearing face masks is that you should wear a face mask whenever you are within 6 feet of anyone and when you are in shared spaces. And it is a requirement that you wear those face masks. And if you can't, we ask that you not come into the buildings. Our idea is that our best defense against this disease is making sure that we wear our face coverings and that we maintain social distance and that we sanitize our hands at all time. I feel like I'm doing John's job right now, but that's fine. He's taught me well. So that is our guidance. And for those people who don't, we will, it depends on who they are, of course. The code of conduct is addressing those students who refuse to adhere to the health guidance over time. We're also developing guidance within the Resilience Steering Committee about how to deal with in-person, in-the-moment situations. We don't want to be in a situation where we ask the police to monitor any of this or to have to deal with this. So we're going to prepare lots of strategies for people to deal with people who are non-compliant. And then if we have people who are faculty and staff who refuse to wear face coverings, it will be a requirement to be on our campus to do that. And if people aren't willing to do that, then they can work remotely. That is one of the great things of our planning, is that if you can't adhere to our guidance, then we have another way for you to continue to work.
Yeah, can I just add to what Jovette said there, Chris, she is absolutely right. The key to virus control is mask, hand hygiene, distance. It's not testing. In fact, if we all did mask, hand hygiene, distance appropriately, we wouldn't need testing. So testing is not a magic bullet. It's an important tool, but it's really about the behaviors: mask, hand hygiene, social distancing. And that's been taken into account, as Ann mentioned, in all these plans.
Great, thank you. Yesterday, many people were notified that they do not have classroom space for their classes. How should faculty go about handling this? Does this mean they can then teach their class completely online if there's no adequate classroom space for their class?
So we have not completed placing all of the classes in classrooms yet, and we are continuing to place classes in classrooms. We have about 20% still to be placed in the classroom, but the registrar is knocking that number down sometimes by 100 or more per day. So continue to look at the classroom assignment for your class. Of the classes scheduled to date, only 9% of the undergraduate classes will be fully remote because they are so large. Okay, so it's the size. If the size will not fit the capacity of the rooms available, they will be forced to be online only. I can also say that 90% of graduate classes are finalized. Roughly 60% are planning to be remote. That's largely by request, which we are handling one at a time. And 30% are operating in the full cohort in-person mode.
Great, thank you. In the case of language teaching, the pedagogical value of all online may exceed the in-person with masks and social distancing due to the need for clarity in speaking and listening. Can FlexEd accommodate this? And more generally, gotten a lot of comments how FlexEd seems to be flexible for students, but not nearly as flexible for faculty members. And so why go with FlexEd for all classes rather than rely on faculty to teach their course in a way that they deem best for their students?
Right. So I think I answered the question as to why go for FlexEd. I think that's fair to say that it's more flexible for the students than for the faculty, just in the sense that the faculty has to provide for an in-class experience for the students in the guarded posture. So I think that is fair to say, but nonetheless, we think it's very important to provide that opportunity for students. And I tried to answer the question about why it is that we think that students really want to have an in the classroom experience, namely because they find it to be useful for being accountable, for time management, for seeing each other. And in many cases, it will be very valuable for them to be interacting with each other and with the instructor in the classroom. It is possible, though, to conduct breakout sessions with Zoom in the same way that you would conduct breakout sessions with Zoom if the students are sitting in the classroom as out of the classroom. That is, they can just bring their headphones and their laptops, and they could use the classroom as the space where they actually do this study. So we don't see any reason why we should prohibit the students from actually using the classroom space as the space where they actually participate in the class. So I think that's the value in those cases where a professor believes that the fully online is the best route. It still is possible to conduct the class through Zoom or through the breakout rooms online while the students are in the classroom. And then there is the benefit that I've mentioned of the students being able to be in the classroom.
Great, and can you talk a little bit about like the language situation? I mean, so that the same kinds of things would apply, right, for the classes with the languages as well.
Right, so you're talking about language learning classes?
Yes.
Yeah, okay, so those could be a very special case. And I know that there are discussions between the language department chairs and the associate dean in the Dietrich School of Arts and Sciences, and they'll make a decision about how best to teach those classes. If it's really necessary to be able to see each other and see each other's lips and so forth as the language is being spoken, then it may indeed be best to have cameras on. It is also possible to get masks that have clear windows around the lips so that lip reading is enabled, or so that one could, see other people speaking.
Mm-hmm. And so kind of as a follow-up, you mentioned in your introductory remarks that the students overwhelmingly wanted, to come back to campus and everything else. We've had some questions and some talk right now in the Q&A about with the faculty surveyed and why are decisions being made solely on the basis of what students want as opposed to faculty considerations or other kinds of things. Can you talk a little bit about that?
Well, faculty were also surveyed, and faculty were also part of the task force on reimagining a PIT education. I think, faculty have had input, and we have listened to faculty. We are trying to balance the needs and the desires of many different constituents here. And we believe that we have found that in Flex-It Pit, a way of achieving the really most serious concerns and desires of the faculty, that is the ability not to be in the classroom if they feel it's unsafe for them. We've achieved that with Flex-It Pit, and yet we can also still meet the students' interests and concerns.
Okay, so I have some timeline questions here that are pretty specific, and so I want to get those out now. When can people get access to their offices again? I think this is a Javette question.
So people can get access to their offices on an ad hoc basis right now. I think we previously had a website that said, here's how to do it. What you need to do now, because I think that website is down because we're in the process of transitioning, is to call facilities management, work with your dean. We can get you in on an ad hoc basis to get whatever you need out of your offices. We are in the process of each school completing their activity area plan, which will allow us to then authorize all the faculty who are going to be back in their classrooms and back in their offices throughout the course of this term. Once those plans are complete, then people who need long-term access to their offices and to the buildings that will be granted.
Okay, and I believe you mentioned this, but so the classroom schedule, when do we think this will be finalized? I mean, are we looking at another week? I mean, is there, because we've heard from some faculty that it's hard to tell like what they want to do, if they want to teach face-to-face or if they want to teach remotely, if they don't know what their classroom space is going to look like or what classroom is going to be, what's going to work better for them. Right.
So let me just explain a little bit why this is so hard. First of all, there's a great deal of inspection of classroom that's going on. We're inspecting the HVAC. We're making sure that it's working perfectly and tuned and looking at the airflow. We are marking off the exact number of spaces and making sure that's all set. And then as we assign classrooms, in some cases, deans or faculty are coming to us and saying, actually, we need something slightly different. And so we're accommodating that. And so we are finding that we need to rerun this algorithm over and over and over again, daily, to optimize, to get closer and closer to the optimal use. The fact is we have only 16% of the normal capacity of classrooms when you count up all the spaces in all the classrooms. And so it's a very difficult optimizing problem. Furthermore, we are continuing to add new spaces. For example, we're going to add a tent that will allow for an outside kind of classroom experience for certain classes where that would be very useful because of the expelling of air, shall we say, in the class. And so because we are consistently adding new spaces, we're slightly changing, that's why it's somewhat difficult. So we're down now to the last 20%. And I can't tell you exactly what day, but I do hope that within a week, we'll be very, very close to the exact arrangement. We're also adding, now installing the technology. And I think it would be probably really worthwhile to ask Mark about when this technology installation is going to be there's going to be a critical mass, because I know that faculty are very interested, for example, in practicing in classrooms. So maybe Mark could talk about that.
You're on mute, Mark.
You're on mute.
Mark, on mute.
My bad. As soon as classrooms come online, we're going to make these classrooms available for demo days, for lack of a better description. So we'll have visibility into what that timing will be next week.
Great.
And then we will make time slots available for folks to get in and give it a whirl.
And in
That's
the
it.
Teaching Center, we're also working on some documentation and some other resources to assist with that.
Yeah, videos will be available as well.
Great.
Okay, so this is, I guess, a question for John. There's a plan for testing students, right? But what about testing faculty and staff? And a related one that kind of came up in the Q&A is, you're based on your knowledge of the virus and everything else, do you have a recommendation for faculty who are trying to decide whether or not they want to teach remotely or teach face-to-face?
Yeah, thanks, Chris. And I saw in the questions that people had submitted ahead of time, there were a number about testing. So, just a couple of things, and also questions that I saw in the chat. Yes, there will be an arrival quarantine. We're asking students to quarantine for 7 days at home and then 7 days when they get here. Yes, we will have students in small groups that interact very closely. And as Jovette and Ann said, mask and distance everywhere else. Contact tracing has been happening. Pitt has been doing contact tracing for students and for faculty and staff since the spring, and that will continue. Now, in terms of the testing, we're not, again, the reason that we're doing the testing is all these students are coming from other areas. And we want to know the point prevalence of how, what is in the area, because if the prevalence is low, then we continue with the plan we have. As I mentioned, we're bringing in students phased over a number of days, over about a 2-week period. So if the first group comes in and they're tested and the prevalence is higher than we would expect, we have the flexibility to slow down the next cohorts arriving. So again, it's all about, and this plan was developed by a lot of people, but the thing from the scientific and medical standpoint that's important is it allows us to respond to conditions on the ground, which we all know change rapidly. 2 months ago, we would have been worried about students coming from New York. Now we might be more worried about southern states. In a month, like that could change again. So, students that are coming to the area, a systematic random subset will be tested, so we know the point prevalence. We're not mass testing anybody, and we're not testing asymptomatic faculty, staff, and students that are already here, because we know what the local rates are. Allegheny County does a great job. They have a great update every day. Anybody that wants to can sign up for it. And in terms of the questions about sort of what we do with that, students that are positive will go into isolation, and we have a lot of isolation beds. People that are exposed, students or faculty students will go into quarantine, faculty will be advised to. Again, I want to emphasize, mask, hand hygiene, social distancing. If the faculty member has been doing this, then they should have zero exposure. They should not have a close exposure without a mask or longer than 15 minutes. And I saw a question there, like, what do I think about it? I've been seeing patients and I've been teaching graduate students and postdoctoral trainees this whole time. I wear a mask, I keep my distance, I have lab meetings with my people, mask, hand, distance. The same tools work in lots of settings. I'm not telling people what they should do. We're not making students come to class if they don't feel comfortable. Faculty have the option to teach remotely, but I think that this is our reality for a time to come. Mask, hand hygiene, social distance.
Right, thanks, John. Let me stay with you for a couple here. What is the protocol for when a student tests positive in a class? Will faculty be notified? Do we all need to quarantine, or how will that unfold?
Yeah, that's a great question. So, the testing is going to be done locally. And so we'll know for symptomatic students or these early arriving asymptomatic students that we're screening, we'll know very rapidly. And part of the contact tracing for students who've been in class absolutely includes, and in fact, not only will the contact tracers ask the students, we have the students' class schedule. So we can say, oh, you were in Professor Cudd's English class, 2 days ago. Professor, like, what happened when, Chris was in your class? And Ann will say, well, Chris stayed in his seat in the back row. He always sits in the back row. I don't know why. And we had our face coverings and I never came within 6 feet. Great. You're not an exposure, Ann, and so you're fine. So again, people observing the behaviors, I see the questions about the students and the challenges there. Lots of people are working on that with carrots and sticks to work on student behavior. That is important. But, you know, in terms of us protecting ourselves as faculty, that's much more on us to observe the mask, distance, and hand hygiene to avoid us needing to quarantine. I don't want to go into quarantine. I talked about the contact tracing and just the next question, of course, operational posture. So there's a complex dashboard that's getting more complex with data that includes a lot of factors that every week or more often probably when the students come is looked at by the healthcare advisory group and lots of other people, the Resilience Steering Committee, the senior leadership team. There is no sort of single hard and fast number you can say because it depends on, you know, number of cases, percent of new cases, are they rising or falling? How many people were already infected? Hospital beds, what's happening in the county? I mean, one can imagine there's a lot of factors that go into it, but all of those are going to be watched very, very closely. And there's no question that, you know, the university will shift postures and react appropriately.
Can I just follow up on one thing John said about contact tracing and students in the classroom? So as a student tests positive, we will do everything we can to make sure that we do all the contact tracing. We will try to keep the confidentiality of the names of students who test positive as well as we can. So we'll work with the student to make sure that we get the names and that we can reach out to the people who have been in close contact. But we will try to keep the names of people who have tested positive confidential.
Yeah, I misspoke, sorry. It would be Ann, a student in your class tested positive. We won't call out Chris.
Correct.
So a couple other quick hits that just came across in the chat, and I know that John, you have quick answers to this. So the first one is, what is the turnaround time on test results?
Turnaround time is going to be, in most cases, about 24 hours. Once we get some new equipment in student health, it may be shorter than that, but within a day or two, and that's very important in order to be able to isolate, do contact tracing, quarantine.
Got it. And face shields versus face masks. Is there any recommendation from you or from the healthcare advisor group, whatever else, as to if one is, are face shields permitted? Are they permitted but not ideal? What is?
There has been a lot of discussion about this, Chris, and it's a common question, especially for issues where seeing the face is really important, like lip reading for those who have impaired hearing. And what I can say is, you know, a face shield is not as good as a mask, and it's not a substitute. The CDC recommends face shields as like a secondary choice. There are data for influenza using a cough simulator, so it's not actual human-to-human data, but that's how these studies are typically done, that at a close distance, a face shield is not as good as a mask to prevent against these flu droplets sort of getting there. Reminding we should be 6 feet apart. So the policy is not quite finalized, but I think what it's going to be is that if there's a compelling reason that person needs to use a face shield that comes all the way down below the chin and wraps around the face, that will be allowed. But again, people, you know, should note that it's not quite as good. So I don't think people should think, well, I don't like the feeling of a mask, so I'm going to go with a shield. That would not be good.
Right. Thanks, John. Couple things that we've gotten from the Q&A. This, I guess, would be more for Ann. Are we allowed to ask students where they are, what time zone they're in, and things like that, so that we can figure out what to try and do synchronously?
Sure. I mean, I think that's a great idea. Yes.
Okay. There's much confusion among faculty when we hear the term in-classroom experience.
Yeah.
If a faculty holds live synchronous classes with students from their home, does that count as an in-classroom experience, or does this term only mean a live faculty in the classroom experience? Like, so can you
Faculty
clarify?
member yeah, the faculty member does not need to be in the classroom to provide for the students a live in-classroom experience. So it's the students who need to be provided with that. Faculty need not be in the classroom.
Okay. This one for Mark. How do we sign up for tech support for turning on the classroom tech if we've decided to teach remotely?
Well, we're still working through those particulars. One option for the integrated classrooms that we're working on installing with Radiant is we can have all the technology turn itself on for the class scheduled time. We also have the ability to remotely turn on technology from where we're monitoring all of the technologies in the classrooms. And we're working through how we can get close to that for the non-fully integrated technologies in classrooms.
Great. John, can you talk a little bit about the rationale behind requiring students to quarantine for only 7 days in Pittsburgh instead of 14 once arriving in Pittsburgh?
Yeah, so a lot of that is based on the numbers of where our students come from. So the largest group of students are from the Southwestern PA region. So they're here. And then the next largest group by far is the rest of the state. So the vast majority of these students are going to be driving here. And driving is a relatively safe form of transportation. And then we're providing students with instructions that for those that do need to travel by other routes, which of course predominantly in the United States is flying, for ways to travel safely, to avoid exposure on the way here. We're still requiring that quarantine period when they arrive here, which is, again, because those are the most important aspects, that distancing is an important component of repopulating the campus.
Okay. So childcare is on the minds of lots of people, especially with the status of schools right now in flux, not to mention safety. So what can Pitt do to help faculty members who are trying to teach their classes, in addition to assisting their children with often synchronous learning that may overlap with the class times in which they've already scheduled to teach?
So the question is childcare. So we have, of course, limited slots for childcare at our Child Development Center. We have limited ability to actually provide this. However, what we have found is we've found an organization that can provide a tool for matching available childcare slots with people who need childcare. And we will be hosting a webinar, I believe the week of August 3rd, with this organization, so you can learn how to use this online tool to match with available childcare slots. And HR will also be getting trained on this tool so that they can help as well.
I guess this is probably a question for Cynthia coming from the Q&A. Given the well-recognized weakness of the current OMETs and some of the biases that are implicit or explicit in them, how has a new tool been developed to evaluate faculty teaching performance under this new model? How are we thinking about, evaluation and assessment under the Flex at Pitt, which is much different than the traditional classroom model?
Well, I think that for assessment, we're talking about assessment of teaching, not student assessments. Last spring, there were a few questions that were added to the surveys, and the surveys were done only for the faculty members themselves, so they weren't circulated to chairs and deans and the results. For this coming semester, that's just something we haven't gotten to yet. So we will be discussing that, and the Office of Measurement and Evaluation Teaching will circulate information on that. Unless there's anything else you want to add, Anne, to that?
Yeah, no, I would say that we will be discussing it with Faculty Senate and, trying to come to the best solution here. You know, on the one hand, we want this feedback, and faculty need to learn from the feedback as well. On the other hand, we fully understand that this is an unprecedented situation, a brand new modality for teaching, and we certainly don't want to, you know, penalize or treat harshly any faculty member who's doing their best under this circumstance.
Okay. Question, a basic question about PPE. Can someone talk about what kind of PPE will PIP be providing? I don't know if that's a Javette question or a John question.
I don't have the exact details on that, but Pitt will be providing cloth face masks to all students and face masks to faculty, is my understanding.
Yep,
as well.
that's right.
That's Javette.
So we have ordered face coverings for faculty, staff, and students who will be on campus, at all campuses.
What is the protocol for substitutions if a faculty member were to get sick and could not teach their class even from home?
So this is a matter that each school and each dean will take up with their faculty. I know, for example, in the Dietrich School, they were asked to find a teaching buddy who could take over if necessary. But I think that's best handled in the school. After all, we already have the issue of people getting sick during any normal time as well. And so that's usually handled on a kind of ad hoc basis, depending on how sick someone is, how much time they'll miss, and so forth. So there's not a general rule for that.
Okay. There's been a lot here on classroom cleaning. Is there some way, and I know the shared spaces, I believe, has been posted, whatever. So could someone just address for the larger group here, what is the protocol for classroom cleaning? Who's responsible? Who's providing the equipment? All that stuff.
So I'm not going to get all the details right, but there is a standard and guideline on the cleaning of classrooms, both in the mornings, I think in the evenings as well. And then in between classes, there will be requests for people to self-clean their seats and things of that nature. But there is a standard and guideline. It is on the policy website. I think it is also summarized on the coronavirus.pitt.edu website as well. And if there's not a summary of it, there's at least a link to the policy website for the exact standard and guideline. And by the way, these should be incorporated in the school's activity plan so that people can find them quicker than having to go
Talk
through
about what the school activity plan is, Javette. I'm sure I'm familiar with what that is.
Sure. So an activity area plan is the way that each unit, this could be a school, it could be an office, it could be a department, is going to operate against all the operational postures, pulling into one document the university-wide guidance and how that impacts the workers, the students, the faculty, the staff in those particular areas. And these are being developed as we speak, and they're being posted on the coronavirus.pitt.edu website as they go.
I think that's an important thing as well. So when new standard and guidelines are issued, they will be available on the coronavirus.pitt.edu website. And so I believe there'll be one on instruction. I don't know if that's been posted yet or will be posted.
I think it was posted this afternoon.
It's up there already?
Yes.
Yeah.
Okay, so yeah, so which has more details on Flex at Pitt and other kinds of things about instruction during the next year. Question about counseling in the Student Counseling Center. Given the increase we're seeing, I mean, it's a high anxiety time. It's a time of high stress for a lot of people. Do we have plans to increase the capacity of the Student Counseling Center, or do we have enough capacity to handle what's likely to be an increase in students who are going to be seeking services either in person or virtually?
Well, we are constantly monitoring that. They've actually done a great job of reducing the wait time to virtually zero. I do believe the plan is still to add certain kinds of special special case kind of counselors, but for the most part, we don't believe that this will be a problem.
And Cynthia, a quick question about the seating. So are you recommending as a best practice that faculty who decide to teach in person assign seats to students to help with the contact tracing should someone in their class fall ill?
It's a good idea to do that, although that hasn't been an explicit recommendation, but I know some faculty have been talking about doing that.
Okay. Question about the future. How should we think about spring? Should we plan to be, since now we're in the process of starting to, I mean, we're always at least one semester, if not 1 year ahead. Particularly for those of us who have kids who are school age, should we be prepared to have a situation like this in the spring?
Well, I think we can't plan on how the virus evolves and what happens with the pandemic. But what we can plan for is the possibility, maybe even the likelihood, that we will still be in pandemic, that we won't have vaccine and universal use of vaccines or herd immunity by the spring. And given that reality, it seems to me that it's only rational for us to plan for Flex at Pitt also continuing through the spring. And then that will give us the time to determine whether next year we're still in this situation or not.
A couple questions in here too about exams and monitoring exams and test proctoring. Is Pitt developing or utilizing anything to allow for easier monitoring of virtual exams, or what kind of recommendations do you have as faculty design their courses on that aspect?
I can take that one. So there is a good bit of information on the website about assessment strategies. And for some courses, it may make some sense to rethink the strategies, and our consultants can help talk about that, or you could see what's on the website related to that. We don't right now have a one-size-fits-all universal remote proctoring tool, but that's something that we're looking at, and there will be more information coming out about that too.
Okay, we have time for one more question before we wrap up, and there's been a lot of this both in the Q&A and also in conversations across campus. And that's about the increased workload for faculty and staff during this time. And particularly concerns about evaluation of faculty for those who aren't tenured, those who are on fixed term contracts, and a lot of anxiety, I think, about evaluation, in the sense that the expectations that faculty have for things they do, whether it be research or teaching or service, are dramatically shifted, under this pandemic. And so, what are the current thoughts, or what are the plans? I mean, I understand that things may not be decided yet, to account for that in faculty evaluation, in terms of movement toward promotions and contract renewals and questions like that.
Yeah. Well, I think the hard fact of life right now is that everything's harder for everyone in terms of getting your work done, in terms of how much time it requires to be prepared to go out into the world and to face the public and all of those things. And I think we all understand that. And so naturally, expectations for productivity, if you will, are going to be lower for this period of time. And in fact, we already have taken account of this in the tenure stream by adding a year to any faculty member who requests it can have a year to their tenure clock, for example. And I know that many deans have discussed, how to try to take account of this for appointment stream faculty as well. But there it's a little bit harder because there's no specific timeline for their promotion to the next level. And so it's a little bit harder to say how that'll be taken into account. But as I said before, I have no desire to penalize anybody. I think the faculty have been incredibly heroic, resilient, flexible, and done great things. And I want to thank the faculty for that. I think that's been terrific. And because of their great, all of our efforts, we've been able to not have any layoffs, not to dock anybody's pay, not to do anything like that, but keep our faculty and our staff and our students together as a community. So I think that, you know, at this point, we need faculty to also trust us that we are not aiming to penalize or to be harsh, but rather we're embracing their enthusiasm and their adaptability and their flexibility, and we're very grateful for it.
Thank you very much. I want to thank Provost Cudd, Vice Provost Cynthia Golden, Vice Chancellor Mark Henderson, Senior Vice Chancellor Javette Washington, and Dr. John Williams for assisting us today and for answering many of our questions. There are many questions, obviously, we did not get to. As a reminder, a recording of this town hall, as well as answers to some of the questions that you have written in, will be posted after the fact. And so if we didn't get to your question, please check the Provost website for that. Also, please be sure to check coronavirus.pitt.edu to see the most recent information about standards and guidelines that have been developed, advice on how to proceed on certain kinds of situations with shared spaces, face coverings, all kinds of things are up there now and will continue to be up there over the next couple of weeks. And as always, the Center for Teaching and Learning recently uploaded their Flex at Pitt Playbook. A lot of resources and information available for faculty there as well. Again, I am Chris Bono. I am Professor of Political Science and President of the University Senate. And if you have any questions, concerns, or anything else as things come up, please continue to reach out to either the Senate, our official instrument of shared governance, or to anyone on this panel. Thank you very much and have a good afternoon.
Thank you all.